I think this is a great topic because you know, if you live with migraine or if you love someone who lives with migraine, that there are a lot of tough conversations that you have to have in your life about migraine with a whole range of people in your life. And some of the goals that I really was thinking about today when I wanted to talk to you was I want you to feel empowered and prepared, and that you're your own best advocate when those conversations arise. And one of the best ways to feel empowered, feel calm, feel confident is to rehearse it in advance. You want to think about what you want to say, how you want to say it. You want to have your information ready so you can deliver it in an effective way. And if you live with migraine, I bet there are half a dozen things that you hear fairly regularly. And I know because I hear them on social media. Patients tell us there's some common phrases, comments, questions, some that can be really annoying that you hear over and over. And I really encourage you to practice these conversations in advance so that the next time that you're asked one of these questions, it doesn't take you by surprise. And you have a calm, educated, constructive, confident response that leaves you feeling more empowered and leaves you feeling like you've actually improved the relationship of the person that you've talked with rather than it becoming negative or adversarial, confrontational. So, as I talked about, my goals are I want you to feel more empowered, I want you to feel confident, and I don't want you to feel embarrassed, ashamed, or stigmatized when you talk about living with migraine. So the first thing I want you to think about are your rights. And I think when people live with any chronic illness like migraine, that you do start to feel disempowered. Maybe you start to feel guilty, embarrassed, ashamed, frustrated about how the disease has affected important areas of your life, which may be work, it may be school, it may be your most important relationships, maybe your spouse, your significant other, your children, your other relatives in your family, your closest friends. And so a lot of times we'll start to carry with us a lot of feelings of guilt and embarrassment and kind of weighs you down. And so I want to remind you of your rights. So your rights are certainly that you are the best expert on your body and yourself. You are also the best expert on your healthcare. And your healthcare and treatment decisions are between you and your healthcare professionals and no one else. Those are the people, you and your healthcare professional team are the people who get to make those decisions. So you can share as much or as little with the people in your lives as you want to. That is your right. And I want you to feel confident about that. But I really want to talk about some of the places and people that you're most likely to have these important conversations. So let's first talk about the workplace. If you are indeed still working. Now, sometimes you might get work questions and you are no longer working due to migraine or another chronic condition or a combination of conditions. And then you also get questions that may be uncomfortable or awkward. And I want to help you think of ways to respond to that make you feel confident and empowered. So in the workplace, this is a little bit different because at work and at school are places where you do have additional rights and protections and maybe afforded some accommodations. And so think about that going in. And so at your workplace or at school, I like to advise that you always start out right at the beginning with sharing your medical information with the right people. If this is work, it's usually going to be HR, and it may be your boss. If we're talking about school, it may be, if you're in college, it may be the Office of Disabilities, which almost every academic institution has. Or if you are high school, junior high, younger, it may be a school principal. The best thing to do is start with a very basic, clear letter from your healthcare professional with your diagnosis of migraine, a sentence or two about the treatment, especially as it might impact work. For example, you have a certain medication that you need to take at work. You need to take as quickly as possible. You then will need a quiet, dark place to lay down or relax if possible. You know, get that kind of information into a very simple, basic letter and take that before, if possible, before you have a migraine attack, before migraine interferes with a final exam or a major project at work, so that that's already known. And also you can work with that person or team of people to figure out what accommodations you might need. Sometimes it can be a pretty simple request. It might be lowering the lighting or getting ambient light, moving into a place that's cooler, or taking your breaks, making sure you stay hydrated, and making sure that you get to move around and stretch. And all of those things are really protected legally, as well as just the kind and ethical thing to do. So it would be surprising and sad if a workplace did not honor that just from the conversation. I doubt you will have to go to a legal extreme. Usually the conversation is enough. If you are talking about in an academic setting, you may be afforded other accommodations. There are all sorts of additional help and support that the Office of Disabilities can provide. So that's work or school to a boss or to more of an administrative level. But then of course you get the workplace questions from colleagues. They may not be questions, they may be comments, they may be looks, they may be negative feelings you get. And a lot of people will say that when they work with colleagues, that migraine interferes with work in a way that sometimes starts to feel like it impacts other people. So you might hear, you're leaving work again early, or I wish I could take off again, or you know, we really need you on the team, we need this project, we need to get this done, we've got a deadline, that sort of thing. So when you hear those conversations, you have the right to decide how much or how little you want to share. And it probably depends on how close you feel with the person, how close your relationship is. Do you work closely together? Are you going to be interacting quite a bit? If so, then a good place to start is education. So to explain in a very succinct sort of way, I have migraine. It is a chronic neurologic disease. It is not just a headache, it's also a set of symptoms which make it very hard to function, like sensitivity to light, sound, smells, and as well as sometimes nausea, and whatever other symptoms you want to share. Dizziness or vertigo or fatigue, whatever you want to share. Because there is still, even with 1 billion people on the planet with migraine and 40 million Americans with migraine, still a real lack of understanding about what migraine is and that it is beyond just a severe headache. So a succinct statement about what migraine is. And you may want to say something like, it's quite common. 1 billion people on the planet have migraine. And I wouldn't be surprised if you come across other people in your workplace or school who do have migraine as well, or live with someone who does have migraine, so they might understand it a little bit better. So get that out there. And if you're looking for some very clear ways to say this, we're going to write a couple sentences on the AMF page, that website, that you can say exactly, you can print out. You could print out the whole a whole article from the page, or you could just suggest that they visit reputable websites like the American Migraine Foundation, American Headache Society, National Headache Foundation to get reputable information. So start with education. And what might happen is you might feel uncomfortable because you're opening up a real vulnerability. But a lot of times when we share that vulnerability, it is kind of amazing the responses we get. Almost everyone alive, especially once they reach adulthood, lives with something, whether it is a physical or emotional, psychological disease or a condition or other hardships. And a lot of times by sharing our vulnerability, we will end up also hearing from others their vulnerability and kind of connect on a deeper level. So know your rights. Don't be embarrassed. Again, I'm going to say it again. This is a chronic neurologic disease that affects people around the world. It has been with us as humans since the dawn of human history, so it doesn't seem to be going away. In fact, it may even have some functional reason why it's been around for literally thousands of years. And when you have an attack, here's what to expect. So you also want to tell people what to expect with an attack. That may vary from person to person, so you want to explain what it feels like to you. And this is going to be something that's very important for other loved ones. So let's talk about family. Let's talk about your spouse. Let's start with a spouse or an intimate partner or another person in your family that you're close with, who you live with, or who's close in your life. So that person's coming from a different place than a coworker, right? They love you, they care about you. They're probably pretty worried, but They may also feel frustrated. They may be mad at migraine. They may be mad at the universe. They may feel frustrated at you that they have to pick up extra share of the housework or work with or taking care of the children. And that's something that, while you may feel bad about, at times there's nothing you can do about. The most important thing here is just talk about it. Just get this out in the open. Say, how are you feeling? How am I feeling? Have this conversation. Don't let this go on and fester. Don't let this go unspoken. Have a conversation about it. Bring it out into the open. Chances are what they're thinking is less worrisome than what you're worrying they might be thinking. And then once you talk about it, you can start to come up with strategies. And there's a lot of strategies that families can use. And for some of those, since we may not have enough time today, I've written some articles on parenting with migraine and marriage and love and migraine, relationships and migraine. So if there's not enough time today to get into some of those strategies, think about some of those. But very quickly, share what you're going through. Be open and honest. Ask for help. Also, accept help. I want to not only give you permission to accept help, I want to encourage you and implore you to accept help. Now, why? This isn't for you. It's because people who care about you are also feeling hopeless, helpless, and frustrated, and they want something to do. Give them something they can do. So whether we're talking about a spouse and you can say, when I have an attack, if you can bring me my medicine, some water, and keep the kids busy for a couple hours while I rest, that really helps me. Now let's talk about children. Depending on what age your children are, of course, you're going to tailor your conversation to different appropriate levels. But even the littlest of children realize when mommy or daddy's not feeling well, and that's scary to them. So you want to have this open, honest conversation with them starting at the youngest age. You want to normalize, this is something that mommy or daddy lives with. I have these migraine attacks. They come and they will go. You want to let them know you are not going to die. You would be surprised that children may worry that you're actually going to die, because seeing you in pain and in a dark, quiet room is very scary, and they don't know what to make of it. Mommy and daddy's not going to die. I am going to come out of this, and by the end of usually tonight or tomorrow, I'm going to feel better. So let them know that this will pass, even though you and I know that living with migraine, especially chronic migraine, feels a very frequent migraine, may not feel like it shall pass right now. But that's to keep between us. For the children, this will pass. I will be okay again. I will be back to being mom or dad once I get through this. And here's how you can help me. So give them an age-appropriate strategy, a way they can help. For a really little one, it may be just playing quietly in the other room so you can rest. It may be bringing you a cold washcloth to put on your forehead. It may be that you want their, say, can you leave your teddy bear here next to me? It'll make me feel better. Or can you tickle my hair for a minute and make me feel better? My 3-year-old tickles my hair and it's so nice. Think of something that they can do to make you feel better, and it's going to make them feel better and more empowered. So that's thinking about children. Keep it age appropriate. Normalize their fears. Reassure them you're going to be okay again. You're going to be back to their mom or dad again. Let them know how they can help. So dating. Let's talk about dating. So this is someone who, assuming you're dating someone you're interested in and excited about and hoping it goes somewhere, maybe you have told them about migraine. Maybe they've already seen an attack, or maybe you've canceled or been afraid to make some plans because of migraine, haven't really shared yet what it is. Like everyone else, let's get it out there right away, explain what it is. They may live with migraine or have someone in their family with migraine, so they may already understand, but they don't. Again, start right off with the education. Let them know what to expect. Let them know what an attack feels like for you, and let them know how they can help. That's going to be really, really important. Again, chances are when you open up with that vulnerability, you're going to find that they also have something that they're living with, maybe more than one something that they'll end up sharing with you. And if they don't right now, at some point in life, they will. So just open it up, normalize it, talk about it, and whatever emotional feelings you have about it, go ahead and bring those out. For example, you may say, I'm going to feel really bad if I need to cancel with short notice. How are you going to feel about that? How can I do that in the best way? How can we navigate this together? What's the way that will be most respectful and work best for both of us? So think about that. Now, with all these conversations, I've given you a lot of ideas and suggestions. And as you're listening, you're thinking, okay, that's going to work with this person, that's going to work with this person. But when you get in the moment, a lot of times it's a surprise, and it's something that's very emotional for us. So because it's an emotional topic, the sympathetic nervous system, that's your fight or flight response, that might get going. When the fight or flight response gets going, we lose our ability to remember things and to think clearly, and we're just in survival mode. So when you're hit with one of these conversations, whether it comes from a boss, a nasty comment from a coworker, a disappointed look from a close friend, I want you to be ready and confident with what you're going to say. So I would like to encourage you to either find a partner who's willing to help you role play this. It could be a friend, a roommate, a family member, or it doesn't even have to be a real person. It could be an empty chair. It could be this plant. It can be a stuffed animal. Doesn't matter. You might feel silly, but if you were seeing me in my office and we were doing a therapy session, this is exactly what we would do. We would practice this. And the more that you practice having those conversations, do them out loud, the more confident you're going to feel in saying what you want to say, and the more fluently and eloquently it's going to roll off your tongue. So I encourage you to come up with your own talking points, have those practice conversations out loud in the car, in the shower, with a friend, whatever works for you, so that when you are faced with one of these tough conversations, that you feel confident in answering.